Um, if you're explaining this to a sibling who's not affected by ADHD, you'd go over many of the things that we just talked about, but there's some other issues involved as well. As would be true for any medical or mental health condition affecting a member of the family, parents by necessity have to spend more time and attention with that child. If it's childhood diabetes, you're doing blood sugar tests and you're doing insulin injections, and you just by necessity have to spend more time and energy to manage that. And it's also true for ADHD. But you need to be aware of the inadvertent problem, which is as you put so much time and energy into that child, the other kids are losing out. And many times other kids in the family will act out, of course, because they are losing out and they want the same amount of time and energy and attention as the other child. So to the extent you are aware of this and you can anticipate this, you almost have to go out of your way to make sure that you give that other child in the family the extra time and attention to reduce the likelihood that they feel that they've been deprived of something. And it kind of goes back to the point you made a minute ago. Sometimes other kids in the family feel like things are unfair. Well, why does this one have, this privilege and I don't? Or why are you letting him or her not do their homework but I have to? So you've got to, again, try to establish a set of rules and guidelines that are fair across the board. But to the extent you can make sure that you're giving the other kids in the family equal attention, if you will, the less likely you're going to have sibling conflict. And a really good thing to do, this kind of goes back to your issue, if you can use rewards and privileges and give them to siblings when they are engaging in pro-social activities with their sibling, they're doing things that promote good interactions rather than negative ones, that can go a long way to resolving or at least lessening conflict between siblings when one of them has ADHD.